Welcome to The Atypical View. I'm your host, Lauren Florio, a licensed marriage and family therapist specializing in autism, ADHD, and broader neurodiversity. As a fellow neurodivergent mind, I'm here to help us learn and spread awareness on all things mental health, as well as help us unlearn harmful stereotypes by providing psychoeducation rooted in research and lived experience rooted in my atypical view. The Atypical View is obviously this podcast, but it's also my private practice where I provide therapy to clients here in California with me and provide neurodiverse coaching to others worldwide. So, without further ado, let's jump into the Atypical View. Hello and welcome back. Today's episode, I thought it would be helpful to continue a little bit of what I had mentioned in a previous episode regarding CBT, cognitive behavioral therapy. So today's episode is going to be about CBT through the neurodiverse lens. I had previously noted that I don't exactly suggest CBT for autistic clients, and I wanted to give a little bit of a deeper understanding around my views around CBT, obviously include some research about why I got here, and share some information about my personal experience with it as well. So let's jump in. With cognitive behavioral therapy, it has been considered the gold standard in the field of mental health for a very long time. It is structured, it is solution-focused, it's often praised for its effectiveness at treating anxiety and depression and other common mental health symptoms and challenges. But for neurodivergent individuals, especially autistic people, CBT can be like a double-edged sword. Honestly, one side of that sword can be a little bit pointier for certain neurotypes. I think I might have mentioned this in the past, but depression and anxiety definitely can come with having different types of neurodivergence, but I find that it's almost always more of a symptom of the primary diagnosis not being treated or supported or understood rather than the primary issue itself, like a standalone issue of depression or anxiety, for example, which I think is part of why CBT is less effective. But let's jump into it. Let's start with the promise of what CBT is supposed to be. It's built on this idea that our thoughts, our feelings, and behaviors are interconnected. And by changing one, we can influence the others. The model can help people become more aware of unhelpful thought patterns and practice more adaptive ways of responding. For some neurodivergent folks, CBT can be useful in managing tools for anxiety, building routines, or challenging rigid black and white thinking even. It's step-by-step in structure and very goal-oriented, and it can also feel reassuring for those who benefit from very clear direction and predictability. The problem I find with CBT directly in correlation to autistic people, there is research that suggests that CBT is less effective for autistic individuals, especially when it isn't adapted to meet neurodivergent needs, and unfortunately, that's most CBT. Most practitioners are not well educated enough in neurodivergent needs in the first place, let alone enough to be able to modify the CBT. For example, a study in 2016 conducted a systematic review and found that the standard CBT had limited efficacy in reducing anxiety, and this wasn't specific towards autistic youth. But other studies echoed this, noting that, again, without those proper adaptations that are often rarely added, CBT reasonably fails to address the sensory issues, the social issues, the societal issues, and processing differences that come with autism. One of the biggest challenges with CBT is that so much of it is focused on building insight and erasing irrational beliefs, which I also just am not a huge fan of that language. I think many of our beliefs are not irrational, and I hate the idea that we're telling people that their beliefs are irrational. Beliefs come from experience, and I think that can be dismissive. So anyway, because CBT focuses on insight often, helping clients become more aware of how their thoughts impact their emotions and behaviors and such. But the issue that I find is that many late diagnosed autistic individuals already are very insightful. So many of the women that I have worked with, late diagnosed, AFAB folks, after years of masking, internal rumination, and self analysis, meaning that insight work in CBT that's so emphasized, it might not really help. It might not only feel redundant, but it can feel invalidating. When your brain already runs 24/7 analysis of social missteps, tone of voice, perceived failures, being told to reflect on your thinking can sometimes feel like adding fuel to the fire. An important consideration here, too, is that telling people that your beliefs of being perceived differently are irrational when they're rooted in reality. We started masking because we have experienced isolation for our differences and have experienced some sort of negative outcome for being authentic to some degree. So telling someone it's irrational to be fearful of societal outcomes is just not helpful, and it can be downright dismissive. So I think that CBT can fall short because it focuses so much on challenging cognitive distortions. That's problematic when it's applied to autistic thinking patterns. A different example might be believing that social situations are exhausting and unpredictable is not a distortion, it's a lived sensory reality. Or having a statement like, I can't handle change, is not necessarily negative thinking. It might reflect really exhausted executive functioning or genuine struggles in that area that needs support, not reframing. This is where trauma-informed and neurodivergent affirming approaches are essential. Therapists have to recognize the difference between distorted thinking and lived neurodivergent experience, and this is where my hopefulness falls a little bit short. Between personal experience and stories from clients and hearing lived experience from other autistic and neurodiverse individuals, I am not saying that understanding the neurodiverse experience is the standard amongst therapists right now, which I see that there is a push for change in that. I see that education is rising, but we're just not there yet. And I want to be honest about that. So pushing cognitive restructuring without first validating those experiences can do more harm than good. And that is why I typically avoid in my personal therapy seeking out anyone who focuses in CBT. And that's hard because almost everyone has been taught CBT. I was taught CBT. I have used CBT in the past, just being completely honest. So let me be clear about where I do think CBT can help. This isn't me trying to totally dismiss an entire modality and say it's not helpful. With adaptation, I think that we can see some areas of CBT actually be really helpful for certain neurotypes. So, for example, individuals with OCD, obsessive compulsive disorder, often benefit from CBT-based approaches. And OCD is a type of neurodiversity. And people with autism can sometimes have an OCD symptom presentation. We see a lot of overlap within different neurotypes, even if they don't quite meet the full criteria for a disorder. I see a lot of my clients come in with OCD-like symptoms that might benefit from some approaches like exposure and response prevention, which is called ERP, which is often used to reduce compulsive behaviors and intrusive thought cycles by teaching structured ways to interrupt those patterns. And that's a really helpful tool for people with OCD and OCD-like symptoms. CBT can also offer useful tools for ADHD. I think externalizing our thought patterns can be helpful. Honestly, a lot of neurodivergent folks are external processors, so I think externaling in any capacity is helpful, not necessarily just through CBT, but still. Developing planning strategies and learning to pause and assess impulsivity, that's definitely helpful. However, again, the work needs to be more experiential, visual, and paced to meet executive functioning needs. Even for autistic individuals, CBT can be helpful when it focuses on practical skills like managing anxiety, creating routines, navigating specific social challenges. But again, only when the approach is affirming and not aimed at erasing neurodivergent traits. In all cases, CBT can become more supportive when it's sensory informed, which means offering tools that account for that overload and shutdown. It can be helpful to be compassion centered rather than like a fix it based focus. It should be really tailored to a person's processing style and pacing. And it should also be used alongside bottom up supports like somatic therapy, mindfulness, and emotional regulation. Now, you will hear me suggest to probably not try CBT and try modalities that just encompass this already rather than need to be adapted. But I digress. It doesn't mean that we can't improve modalities that exist for neurodiverse people. But yeah, you will hear me definitely suggest other types of modalities in its place. CBT isn't inherently harmful or ineffective on its own, but for neurodivergent minds and clients, the intention and delivery matter just as much as the technique itself. And I would encourage most practitioners to consider adding in a modality into their, repertoire of modalities that would be able to support a neurodivergent person on its own, like somatic therapy, rather than have to do the work to try to adapt something that exists for someone else, truthfully. Some modalities are truly just better fits for other diagnoses. And I definitely fall into the camp where CBT doesn't typically tend to be too helpful for autistic, ADHD individuals, things like that. I would rather be affirming to my clients' thought processes than constantly challenging their lived experience. So now let's transition into our second segment, which is, in fact, the atypical view. It is my atypical view. I want to take a more personal look into neurodivergence and CBT and talk about my own experience and where a lot of my opinions have come from. So with cognitive behavioral therapy, I want to explain what it did give me, what it didn't, and other pieces of the puzzle that I think might be relevant from my experience. So CBT has truly been probably a part of all therapy I've experienced. I think that it is probably the modality that is, if a modality is going to be taught in school, it's going to be CBT. They might teach other things as well or give education on it, but CBT is so heavily focused in the therapy community that I truly believe that all therapy I've experienced has had CBT in it. And I want to be clear that like when you're in therapy, someone isn't typically saying, I'm using CBT today. Like that's not, we tend to sort of blend in all of the things that we understand. You might have a therapist who specializes in certain modalities, and typically it'll list that on their website or their bio. I find that it's incredibly hard to find someone who doesn't list CBT in their bio. And when I'm looking for someone with neurodiverse affirming care, that's a big thing that I'm looking for. It's almost my quick fire way to go, I don't know that I want to work with this person, which is it's a personal judgment. It's not necessarily what I'm telling you to do, but it's definitely something I do. So when I think about my first impressions in CBT and what I can reflect back and see was CBT with certain therapists using with me, it felt super dismissive. It felt like I was kind of being forced to mask because I felt like I was being told that I was wrong for the certain perspectives that I've had. And when I'd say, oh, I'm afraid of something happening, and someone would tell me that that's silly or that that's an irrational belief, essentially, it just made me feel like I was bad at thinking. It made me feel like they use the word like catastrophizing and things like that. And it's like, well, one, I wasn't aware that I was autistic at the time. And so all of my, fears and stuff and vulnerabilities that I would start to open up were probably confusing for the therapist, but trying to explain the social distance, I guess, that I feel from others, the isolation that I feel from others, the inability to be myself, feel like it was met with like, you're a great person, you'll do fine. And it's like, yeah, I'm a great person because I'm showing up and masking and being kind in every single one of our interactions because I want you to not hate me and think I'm a bad person. Even to my therapist, I absolutely masked. And that's another reason why therapy can be so challenging for autistic people, is because so many clients go into the space masking because they don't want their therapist to think they're a bad person. So if we mask with strangers, we're going to mask with our therapist. I get that it's the space to be vulnerable, but it's hard to force vulnerability. I to this day, like, language that I really don't like from CBT is always comes back to irrational beliefs. There are times where people have irrational beliefs. The belief is just not rooted in reality. Besides people who maybe have delusions and struggle with being rooted in reality, like having things like schizophrenia and issues like that, or moments of like mania and things like that, telling someone that they're being irrational or that they're not rooted in reality is basically just telling them you don't agree with their thinking and their you don't believe their history of why they got to the place that they're in. You don't know your client's trauma, and to assume that someone is saying, I think I'm going to get made fun of if I do XYZ thing, and you go, you're not going to get made fun of. Like, you don't know that. So telling someone that that belief is irrational isn't helpful. And I try really hard to be mindful about that because, yeah, we want to be hopeful and we want to be positive. And I also want my clients to believe that they can be accepted as they are. And that is true. But it's also true that they've experienced isolation due to showing authenticity in unsafe spaces. And it's really important to stay rooted in that, which again, I feel like CBT does not do a great job in allowing the clients to have autonomy of their history and not be dismissive of it, essentially. I also felt like CBT was like pressure to, I don't know if perform is the right word, but definitely like mask. And when I'd have to check in and do certain things that my therapist would help me, and I'm experiencing it not help me, they would essentially just believe that they were right and tell me to push past the discomfort in a lot of situations. And that wasn't helpful. I'm not saying all people who practice CBT are like that, but that is a part of it. Sometimes it's like, just keep going and eventually you'll get to the other side. And that felt really dismissive for me. As you can tell, a lot of this felt dismissive. The word dismissive keeps coming up. I want to be clear, though, there were some moments that I do feel like it helped, maybe in more like narrow, specific context. I do think that in moments of building specific types of insight, CBT can be really helpful. I will even use, there's the 3 C's of cognitive behavioral therapy, which is the catch it, check it, change it. And that's one that I do use with a lot of clients, especially when the quote unquote belief or thought or whatever that we're trying to change is rooted in being unkind to ourselves. That's almost always where I'm like, hold on, let's reframe that. That's the only type of thing where I'm usually pretty pro let's reframe, is when we're having pretty bad negative self-talk. The 3 C's, catch it, that's the hardest part, is knowing that you're having a thought that doesn't align with your values or who you'd like to be or how you'd like to treat yourself or others. For check it, the standard, I believe, is it helpful and is it true, I want to say. But I always add in, is it kind? That's a piece that I think is really relevant. And basically, if it's not 100% true, if it's not 100% helpful, and it's not 100% kind, how can we frame it to be more in line with those ideas? So we change it to be true, helpful, and kind. So if I say, I'm a worthless human being, I would catch that I'm saying something about myself. And then I ask myself, is it true? Is it helpful? Is it kind? It's definitely not kind to call myself worthless. It's definitely not helpful to be unkind to ourselves. That's maybe requires a little bit more education on shame cycles and all of that, but it's just not helpful. It doesn't help us become a better person to be mean to ourselves. And is it true? No, it's not true. I don't believe anybody's worthless, and I don't think it's helpful to say something like that. So I would change it. And sometimes you change it to the opposite. You might say, I have worth. And that's a really easy switch. But sometimes it's hard to say that to yourself in a moment where you're really struggling. So I might say something that's true and helpful and kind of, I'm really struggling right now, but I still have value. I'm really struggling to be nice to myself, but I still deserve to have worth or whatever. I think that's the main CBT tool that is actually very helpful. I think we need to be checking in with ourselves more about how we're treating ourselves and others. Obviously, it can be definitely be used to others of like, is it helpful or kind to say something to someone else? But most of us are saying some pretty cruel things in our head. So that is probably my favorite and maybe my only tool that I use from CBT. So once I realized CBT wasn't it for me, I didn't know what to turn to. I didn't have the education at the time of knowing that CBT was the problem, I guess. And so I just felt like therapy wasn't working for me. I felt like therapists were somewhat dismissive of my experience and didn't understand me. Having a neurodivergent therapist helped a lot. My current therapist is neurodiverse and I think very affirming in that way and really listens to my experience and validates what I'm going through without keeping me in an unmoving position where I just sort of complain and don't make change. You know what I mean? That's super helpful. And I think having someone who understands a neurodiverse profile by being neurodiverse is awesome. So try to find a neurodiverse therapist. We're out there. I love somatic work. So I definitely think that if CBT is based in insight and challenging our thoughts and emotions and stuff like that, then somatics is sort of the opposite in that way. Somatic therapy is basically a body-based therapy. So I try to balance being in my head versus being in my body by doing more somatic work because I think that naturally myself and many other late diagnosed autistic individuals have great insight and they come in really understanding what their issues are in life and are in their head quite a bit. So I actually find that getting out of our head and into our body is huge and definitely what I now turn to. The last thing I think that comes up is what would I say to someone who's asking the question of like, why didn't CBT work for me? And honestly, I think that sentiment is a great transition into our last segment, which is our call to action. So to the person who feels like, why isn't CBT working? I want to be clear that if CBT hasn't worked for you, it's not your fault. It's just not the right modality for you. And it's not the right tool for your type of brain, for your neurotype. So even if you're not autistic and you felt like it wasn't helpful, that's okay. It doesn't mean you're unhelpable. It doesn't mean that you failed therapy. And I know that feeling. It doesn't mean that at all. It just means that that system wasn't built with your brain in mind. That modality wasn't made for your neurotype or your experiences. Instead of getting stuck in your head, we can try something different. I want to take just a moment to encourage you to go into your body. So like I had mentioned with somatic therapy, somatic therapy is one approach that supports neurodivergent minds by working with the nervous system, not against it. It's about movement and breath and sensation, not just thought. So we can try something simple together if you're open to it. Take a slow breath in through your nose and try to feel the air move down into your lungs. Noticing your chest expand. And I want you to just pay attention to the sensations in your body. Feel your chair beneath you, your seat beneath you. Feel maybe your back pressed up against your chair or your bottom or your thighs pressed up against the seat below you. Just noticing what it feels like to be held in that way. Try rolling your shoulders. Wiggle your fingers. You can even scrunch up your face and your nose and let it relax. And let yourself feel. Feel what it feels like to be in your body. Healing doesn't have to look like everyone else's. It can be slower, it can be quieter, deeper, and it's still real. Thanks for spending this time with me today. If this episode resonated with you, feel free to share it, subscribe, leave a comment or a review, or send it to someone who might benefit from the psychoeducation, or just need a little reminder that they are not alone. If you are interested in my coaching or therapy services, you can reach out to me directly and connect with me at theatypicalview.com. Until next time, stay curious, stay kind, and I hope we can stay connected.